Good morning. My name is Shelley Becker. I am here with my husband, Jeff, and we are in support of House Bill 3121. We are here representing ourselves as Native Texans. We were born in Houston and San Angelo, raised in Fort Worth, and now we currently live in Dallas. Just over 2 years ago, our 17-year-old son tried to kill himself, and he did this by wanting to jump off the roof of a Dallas hotel. Fortunately, heroes with the Dallas Police Department were able to tackle Alec before he could jump. Alec was immediately admitted into local psychiatric hospitals to become stabilized. He was then admitted into the Becker Clinic in Houston. Their psychiatrists told us that Alec would need long-term, meaning minimum 2 months of residential therapy, and that there was nothing else that a psychiatric hospital could do for him. They said that we would need to send Alec out of state to get long-term facility help because the facilities that currently operate in Texas do not specialize in high-quality treatment of mental health and psychiatric issues. The doctors at the Becker Clinic recommended a facility in California. Jeff and I immediately flew there, went to visit it, and we flew Alec in the very next day and had him admitted into this facility to where he spent the next 3 months getting the treatment he needed. To our surprise, half the patients at this facility in California were from Texas. We were fortunate in that we were able to have Alec treated in California, and that well over 90% of the cost of his treatment there was covered by our medical insurance. So the question is, why doesn't Texas have those types of long-term adolescent psychiatric health facilities? Every mental health professional that we have spoken to over the last several years has pointed to the absence of Texas laws and regulations with high standards of care for adolescent mental health. They've told us that private adolescent psychiatric facilities seen in other states don't view Texas as welcoming since our current laws and regulations do not have standard of care focused on mental health treatment. Those facilities prefer a regulatory system in place to distinguish themselves from, for instance, drug rehab facilities or other residential centers. House Bill 3121, it does not force increased standards of care to currently licensed facilities or have the state fund more mental health care. This bill only requires the state to issue higher standards of care, regulations to support a voluntary certification. We believe it will result in new private residential facilities opening here in Texas that will offer the so needed mental health treatment for Texas adolescents struggling with depression, struggling with anxiety, and those that are struggling with suicidal thoughts, which, as we all know, all of these things have now basically doubled due to the pandemic. House Bill 3121 is an inexpensive way for us to provide more options to treat our Texas youth. We hope that you will agree, and I thank you very much for your time.